Hello, everyone. My name is Solome Tibebu. I'm the director of the Upswing Fund for Adolescent Mental Health, and we're here for another episode of Ask the Expert. And I'm very delighted to have Dr. Marie Albano here with us today. Dr. Albano, please introduce yourself.
Thank you so much, Solome. I'm Marie Albano. I am the Columbia University Clinic for Anxiety and Related Disorders professor of medical psychology and psychiatry. And I'm a clinical child and adolescent psychologist in New York City.
And can you tell our audience, what does the Columbia University Clinic of Anxiety and Related Disorders do, and who do you serve?
Besides having a really long title for the center, I founded QCARD, as we call it, in 2004 when I joined Columbia University Medical Center. And I modeled it after an integrated clinical service and research center where I was trained, so that we provide evidence-based treatments for anxiety, depression, and other conditions in youth. And we span the ages 3 all the way through 28, from early childhood through emerging adulthood. And in addition to serving youth and their families, we also think it's very important to stay on top of asking the questions and testing out what works best for whom, and pushing the edge, forward on innovating new research for technology development, treatment development, and expansion.
Wonderful. And we've got quite a few parents in the audience here today. We're coming up on our second fall season of the pandemic. School's around the corner. Can you help us understand, what can parents do to ease anxiety of youth coming back to school?
This is the question right now of the century, right? And it's sad that each century starts with a pandemic, it seems, at least as far as we can think about this. But, one of the things parents need to do first and foremost, we talk about, is let's get a check on our own anxieties, and to make sure for yourself that you have real good factual information so that you know what's happening and you're listening to the experts, so that you can be prepared. And the other thing then is to make sure you're taking care of yourself, soothing yourself. You get enough rest. You have to eat right, get exercise, so you're in good shape. Because one of the main things we've learned from research over many decades is, as parents, when we're anxious, we transfer that to our kids, even without wanting to. So that's first and foremost. The second thing, of course, is your child better than anybody else. And you know what your 5-year-old, 10-year-old, 15-year-old can handle. And so, think about how best to help them understand why things may be a certain way, why we wear masks, and make the masks for the young ones have pictures of their favorite characters. Do things. If you model wearing the mask and others around them, the kids are going to do it. Teach them a good hand hygiene, to follow the program as we've been hearing about it from the experts. The big thing here, especially for our school-age kids and teens and our young adults, is you being able to help them to be flexible. Flexible because there's already, as we're seeing with the start of this school year, in many schools that already have gone back, like in the South, they're having outbreaks in some areas, and schools are shutting down, or they're going on, a quarantine for groups of kids and such. And so it's still going to be a time of change. And the way we meet change is by being flexible, not catastrophizing. So being matter of fact, stick with, what's realistic and what can work in this situation to help us cope. And then I think a big thing for our parents is, again, to help your kids stay in contact with the people who are meaningful to them, which means safe get-togethers and gathering with friends and others and family members, so that they don't feel that their life is just going to be behind screens or unpredictable.
Really wonderful advice. And sticking with the school theme, what about for educators? How can they best prepare for this next school year?
Educators, we've been working with a lot of educators over the last year and a half, and in doing a number of things. besides the fact that the educator themselves in the classroom has to be prepared for their class, be it on Zoom or be it, if they're doing hybrid or full, live class, the school themselves, the administration, and then also you have the school systems and such. They're doing various things to have contingency plans in place. So this is something to bear in mind. And if I just think of the individual educator, for your own classroom, again, you've learned a number of things about which student of yours are most at risk for sort of being left behind educationally, not being able to keep up with the work if it's on Zoom or if it's disrupted in various ways. Also emotionally, who are those kids who have sort of disappeared from your view because hiding behind the screen for those who have a lot of social anxiety or various things has been something that's been able to happen. And the kids who the kids who school refuse for various reasons, it's made it easier. So as educators, you have to sort of have your eyes on that, making sure you're aware of the kids who are not standing out. And then think about, try to have resources sort of at the ready that you can point to and go to, the school counseling center or community-based clinicians that you might be able to refer kids to. But again, I'm going to say, because educators, teachers, you're dealing with your own anxieties, your own families and various things. First and foremost, you have to take care of you. And then you could manage the classroom in much better. And I don't mean that to like trivialize that for the adults. You really have to take care of yourself and be able to assert yourself to your principal, to your administration, what your needs are to be most effective for the kids you're working with.
Again, really good advice. So, Dr. Albano, you've been involved with the launch and operations of not only the successful Q Card Clinic, but a number of other clinics, community-based organizations, which is also reflective of the Upswing Fund portfolio. What advice do you have for them as they serve diverse adolescent populations, many times in areas where there have not been resources to reach or engage them well?
That's a great question, Solome. And, one of the things that we are very much aware of in the mental health arena, and especially when I work in mental health research, is that there are many underserved populations, LGBTQ kids, kids of color, religious kids who have different religious convictions and such. They could be underserved for a number of reasons. One is their own feelings of being ostracized, isolated, or rejected. And so then they shy away from reaching out for help when they need it. Another thing is could be that the community is not open to serving or recognizing that these individuals need more help. And then, of course, we know there's been places where they've been exploited. Historically, people of color have been exploited in research and also in mental health, and stigma that's out there in many ways. So I think communities, it's up to us really to think about not who is just in front of us in any school or any community, but who are we not seeing? And, broadly in our community, who are all the people? Who's in the barbershops? Who are in the cafes? Who's on the playgrounds? Where do kids go, actually? Where can we meet kids so that we can find them and just be available? So I think that we have to think out of the box to bring services through mentoring program and volunteers who are trained as mentors, not just through clinicians and social workers, psychologists, but through mentors, through peer support networks. And also, if there's nothing in your community, think about, okay, who can I partner with in nearby or places where I can reach out and get some help to start an organization or get a little small group of people together that then are more likely to be able to reach the kids who can't get to us so readily.
Great feedback for really everyone. We've touched on each audience. As always, Dr. Albano, so appreciative of your expertise and time. Thank you so much for being not only our Ask the Expert, but one of our esteemed advisors for the fund. Really appreciate it.
Thank you so much for having me. It's great to be a part of this.